Hi, everyone. We're going to go ahead and get started in just a minute. My name's Megan Donnelly. I'm the Nutrition Services Manager at Dr. Shar USA. And today we are going to be joined by Vanessa Weisbrod, who's also on the call. She's going to be talking about some of her really interesting research in gluten contamination in shared kitchen spaces. So I just wanted to go over a few housekeeping things briefly. We are going to be recording this presentation and putting it on the Dr. Shar Institute afterwards. You will be getting an email from me afterwards with your certificate and a copy of the slides. So you will have access to the references and the information in the slides after the presentation. Throughout the presentation, if you have questions that come to mind, feel free to type them in the Q&A box, and we will try to get to as many as we can. And if we miss your question, either Vanessa and I will follow up after the presentation is done via email. And I guess with that, we will go ahead and get started. I just want to make sure, Vanessa, that your sound is working.
Can you hear me okay?
Yes, I can. Okay, perfect. All right, so I'm going to kick it off, and then I'll let you know when it's your spot.
Sounds great.
All right. Okay. So as we are starting this this dive into the a lot of the studies and the work that Vanessa has done, I think it's really important to set the stage for why this research is so important and how the burden of celiac disease really does affect our patients. And studies like this are important because they really show what needs to be done in order to help improve quality of life for these patients. So here are the learning objectives. So we're going to start with very basic the gluten-free diet, and then talk about some of the hypervigilance and quality of life studies that a lot of our colleagues have worked on, and then we'll get into the probably what I'm sure most of you are here for with those contamination studies. All right, so just as a brief reminder, celiac disease is an autoimmune condition that causes symptoms and damage to the intestine with gluten as the trigger. The prevalence is about 1 to 2% worldwide. It varies slightly across different countries, but pretty much around 1 to 2%. And we also have this really difficult diagnosis of non-celiac gluten sensitivity, which is characterized by symptoms that occur after gluten ingestion, and people seem to do better when they remove gluten from the diet, but they don't test positive for celiac disease for a variety of reasons. So when we talk about celiac disease, it's a very clear diagnosis, and I think that's really what the bulk of these studies are geared towards. And then just a brief reminder on gluten, it is storage protein that is found in wheat. So that's what's causing the reaction in these people. We know that gluten-free diet is the only effective treatment for celiac disease, and there are going to be a lot of nutritional deficiencies that go along with years of not absorbing food because of a person is containing a gluten-containing diet. So a lot of times part of our job as dietitians is to supplement make sure that our patients are not deficient in any of these nutrients and supplement if necessary. In order for a gluten-free food to be considered gluten-free, it cannot contain more than 20 parts per million of gluten. And really, when we talk about a balanced gluten-free diet, it's super important that we remember that there's a lot of really healthy, naturally gluten-free foods in addition to gluten-free replacement products like the Sharp brand. So a diet that contains a lot of legumes, fruits and vegetables, gluten-free grains, meat, and dairy, all the proteins, these all should be included for these patients. So when we talk about cross-contact, and I think there's a lot of terminology differences, cross-contact, cross-contamination, we're going to call it cross-contact for the purposes of this presentation. It occurs when gluten-free foods or ingredients come into contact with gluten. This happens a lot in food service establishments and restaurants, which makes dining out very difficult for these patients. It can also happen at home, and I think that that's a real risk for a lot of people, especially when they're new to the diet. These are what the current recommendations are, and I want to point out here that these are not necessarily evidence-based. We consider them best practices because of our experience, but they're not necessarily evidence-based in the literature. So that's what Vanessa is going to be talking to you about. So I'm not going to spend a lot of time here, but just setting the stage a little bit. When it comes to labeling and dining, a packaged product that contains the gluten-free label means that the product must contain less than 20 parts per million of gluten. Products cannot be intentionally made with gluten-containing ingredients unless there are grains present that have been processed to remove the gluten, such as gluten-free wheat starch. The gluten-free claim is voluntary, which I think is really interesting. That's why a lot of times you'll see it on foods where you don't necessarily think, why would this say gluten-free on it? It's also why sometimes there can be a lot of confusion for people. And then when it comes to dining out, I think a lot of times this is where a lot of these quality of life issues come into play. Restaurants can maybe they're not so well educated, or they have good intentions, but things happen in the kitchen. They might not really fully grasp the importance of safe food handling. So celiac disease patients really need to strongly advocate for themselves, and so they have to call restaurants ahead of time. There's a lot of work that goes into something as simple as dining out. All right. And just briefly on packaging and what the different labels mean. All of the allergen advisory statements are voluntary, and studies show that this doesn't necessarily give you a reliable sense of if there's gluten in the product. Studies actually show that, these advisory statements, and we're talking, I think this has really gotten better, and these are largely regulated, but there's a lot of different certifications out there, as you'll see on the right. And in order to obtain some of these certifications, companies have to demonstrate that their food actually meets the criteria. However, with so many different certifications present, it might be confusing to people. Why is one better than the other? Why does one label look one way? Why does sometimes it just say gluten-free without a certification? So that's confusing. And then when it comes to the back of the package, the 8 major allergens must be identified on the label, and this leads to these secondary statements like may contain or made in the same facility as, which are also optional and also confusing. In a recent study, I saw this presentation at Fancy. Studies actually showed that those allergen advisory statements, like the may contain statements, were not necessarily reliable predictors of gluten or any contamination in the product. So a lot of times, if the company put an advisory statement on the label saying this was processed in a facility that also processes wheat or something to that effect, that product actually wasn't usually contaminated. But a lot of times when that advisory statement was not present, the product was contaminated with wheat. So something to think about. All right, so getting into some of the quality of life stuff. A gluten-free diet has an impact on almost all aspects of daily life, and so upon diagnosis, patients must learn to adapt their lifestyle to meet their new dietary needs, which means the introduction of new behaviors, intentions, and the costs associated with them. So this is kind of a brief snapshot of all the things that may be affected from an emotional, a financial, a physical standpoint after one makes the transition to a gluten-free diet. The burden of following a gluten-free diet is high, and it really does require constant vigilance. Adherence demands time, purchase of food becomes higher, the food costs become higher, excuse me, and there's a lot of difficulty when shopping. I think what's really critical here is that patients tend to report lower levels of enjoyment of food and leisure activities because of the transition to this diet. So it's really a burden, and there is evidence in the literature that shows that these patients actually avoid restaurants and avoid traveling because of their dietary restriction. So quality of life encompasses a multitude of factors, including behavioral, psychological, emotional, and physical, which really means health related for this presentation. When you talk, all these things you have to manage in your daily life, I just wanted to put some that are really, I think, a burden for people with celiac disease. Management in everyday life, you're talking additional costs, time, access to food, reduced ability to enjoy your food, difficulty finding food that's safe for you. All of this leads to emotional and psychological burdens. There's a lot of stigma around people who are fussy eaters, and people may not want to dine out with someone who's constantly saying that they have a dietary issue. So I think there's a lot of emotional stuff, especially with social relationships. The other thing is that you are losing out on a lot of traditional, very common and very delicious foods when you have to go on a gluten-free diet. So these people often report feeling that they miss their previous diet and that they wish they could have some of these things. So these are some of the most highly reported experiences of those on a gluten-free diet. This was a Canadian study that looked at difficulties experienced often or very often when following a gluten-free diet. So these are self-reported data by patients. It's important to note how all realms of daily life are affected, and such a high proportion of participants report challenges around food choice limitations and the emotional toll that has on them. So everything from purchasing to issues with preparation, eating in restaurants, eating with family and friends, and traveling, all of these things were affected. So the people in this study, the majority of them reported these things to be the most challenging. This is from the same Canadian study, and it's looking at more of the emotional side. So note the decline in the feelings of relief immediately after diagnosis versus long-term feelings of frustration and isolation, which predominate more in the long term. So short term, there might be more feeling frustrated, overwhelmed, but these change as acceptance becomes more of a reality. So looking at the psychological toll, 56% of adults in this study explicitly referenced adverse social impact of adhering to a gluten-free diet. Anxiety and dread, characterized by feelings of being misunderstood, embarrassed, different, stigmatized, left out, awkward, guilty, and burdened with having to explain their situation. And a lot of people felt afraid about contamination, but also the limits it placed in their life. And embarrassing, which I think is related to some of the physical symptoms and the needing to report your diet restriction everywhere you go. And then all of this leads to social isolation and exclusion, including, feeling limited in what they were allowed to do when it came to dining out. And so this was a Columbia study that looked at hypervigilance among teens and children. And the main point of the study was that 70% of the teens in this study explicitly referenced the adverse social impact of adhering to a gluten-free diet. They experienced resentment. This was more prevalent in the teens than in the children, but they, expressed frustration at the inability to be spontaneous like their peers. And these are some quotes from some of the teens in the study. Among the children, there was more low self-esteem present. So extreme precautions during school and social activities, which leaded to low self-esteem and fear of being different. And so, when children say, people's reaction to me changed when I said I couldn't eat certain foods, and because you can't see the effects of the disease, people think it's in your head. These are really causing damage in teens and children particularly. When it comes to disordered eating and depression, this study from Columbia also showed that higher knowledge about the gluten-free diet and all the ways that you can be contaminated or exposed to gluten was associated with higher vigilance, stronger feelings of limitation, and interestingly, lower quality of life. So studies show that rates of depression are higher among celiac patients. And this is maybe something that seems not surprising, but they're also significantly higher in children. So that's something that when a child is being diagnosed needs to be considered. Increased dietary compliance is associated with higher rates of disordered eating. So one study of adult women estimated the rates of disordered eating among celiac patients at about 16%, which is much higher than estimates for the general population. So this is a mental health issue, and these women really are reporting greater levels of body image concerns, stress, overall mental health, and reduction in most quality of life domains. When this is another study that the team at Columbia was involved with, looking at behaviors. So approximately half of celiac patients express more maladaptive approaches to maintaining a gluten-free diet, and those who did so were associated with lower celiac disease specific pediatric quality of life scores. So this is a quality of life score that looks at quality of life in celiac disease patients specifically. So some of the adaptive behaviors were, flexibility, trust, confidence, and awareness. All of these things they looked at, but they also experienced a significant amount of rigidity surrounding the diet, avoiding emotions and certain foods, controlling behaviors, and preoccupation with finding research about their disease, particularly when it comes to cross-contamination incidents. So there is a link between celiac disease and the presentation of disordered eating behavior or eating disorder. Two proposed pathways exist, one due to a fear of gluten contamination in foods, and a second due to a fear of weight gain as a result of consumption of gluten-free foods. So these are the two eating disorder pathways that they are looking at in these studies, and one is based on association of weight gain to because of gluten-free foods, and the other is due to the fear of cross-contact. So these are kind of two of the bigger ones. An eating disorder may result from vigilance and hypervigilance, and concerns about weight gain after the diagnosis may lead to more restrictive and disordered eating behaviors, and this is more prevalent in females. There's also avoidant restrictive food intake disorder, or ARFID, which is characterized by restrictive or avoidant eating behaviors that result in weight loss, growth compromise, reliance on supplements, deficiencies, or interference with psychosocial functioning. So a lot of times these patients will present with fears about eating certain types of foods, certain colors or textures of foods, and they eat very small portions. And this all may be triggered to a traumatic episode or something, but there's more research needed in this area. It's kind of a growing area that I know the team in Columbia is looking into as well. So as dietitians, it's key to understand the effect that hypervigilance can have on patients following a gluten-free diet. The more we can help patients rationally analyze relative risks of various eating scenarios and foods, the better we can help support them and help them improve their quality of life. The first step in this process really is being able to quantify contamination risks. That's why I'm so happy that Vanessa is here, because she's done a lot of this work, and it's new research that really needs to be looked at. So I am going to turn it over to Vanessa here, and yeah.
All right, so are you going to advance the slides, Megan?
Yeah, or you can share, either one. Would you?
Okay, so we'll just keep your slides up and then I'll just
Okay.
do it. Okay.
Okay.
So thank you so much for having me. I'm really excited to talk about some of this research, and perhaps more importantly, talk about really the future directions that we've taken since this study got published last September. So for those of you who haven't seen our study, it was published in the journal Gastroenterology in September 2019. And we started looking at cross-contact in shared kitchen spaces and schools because our program had started a national collaboration to develop guidelines for students with celiac disease in schools. And we wanted to have a national consensus statement on what families should expect at school and what schools should be expected to do to accommodate a child with celiac disease. So we assembled a group of 44 experts from pediatric hospitals around the country, national and local education associations, local school districts, school nurses, school psychologists, food service providers, and everybody in the educational sphere, as well as patients and families. And the first thing that the head of the Association of School Superintendents said to me is, "Where's the data? you have all of these things here asking us to do things in our kitchens and in our classrooms, but not one piece of data to back up what you're asking for. And I sat there sort of dumbfounded that, oh my gosh, these are just the things that we tell our patients every day in our clinic. And, you know, our clinic in GC has been around for more than 10 years. And we've been making these recommendations to patients with no data behind them, really just based upon what we thought was the right thing to do. And at that point, we knew we had to start studying it and that we really needed to understand the true risk of cross contact in these shared spaces, not only for the larger celiac community, but to make really informed recommendations that schools could follow with confidence. So that's really how we got started. So we did 2 studies, and I'm only going to talk about the kitchen study today, where we looked at toasters, pots and pans. We're now looking at cutting boards and utensils. And then we did a second study looking at classroom environments where we tested different activities that children in different age groups would do in a school environment to see what the risk was of contamination. Next slide, Megan. So you can actually put all 3 of them up. So the first thing we did was we pulled what a lot of different national organizations are saying about cross contact. And this really goes to what Megan was talking about with the hypervigilance piece. So organizations that we all know and trust, and the last one is from a physician that I work closely with, are telling our patient families to do these things that make them very nervous. So NASPGHAN, our pediatric GI group, says purchase a separate toaster for gluten-free breads or a toaster oven that can be cleaned between uses, or place tin foil on the rack to avoid contamination. So lots of things to do to avoid the chance of gluten coming into contact. But again, no data behind it. Beyond Celiac says, no, you cannot use the same toaster for gluten-free and gluten-containing items. Cutting boards are a hot spot for sources of gluten, and even our refrigerator door handles can expose you to gluten. And then, of course, our doctor who says you must use a separate toaster. So coming from the mindset of a patient or a parent whose young child was just diagnosed with celiac disease, seeing these things where just walking in your kitchen and opening the refrigerator to get water could expose you or your child to gluten, it's terrifying. And it creates unnecessary anxiety and hardship for these families that may not need to be there. So we really wanted to understand it so that we could help people approach managing the diet in a way that was putting the appropriate amount of vigilance into their lives. All right, next slide, please. All right, so we had several aims of the study. We wanted to quantify gluten transfer from common materials to gluten-free food by our hands. We wanted to look at different types of hand washing. We wanted to look at the transfer from gluten-containing pasta, bread, and cupcakes that were prepared in a shared environment or cooked in shared water, and then see if we could prevent the transfer by either washing or rinsing it. Next slide. So again, this just goes through what I've already explained. The information is also here for the school study, and in the follow-up, if people are interested, Megan can send out that study as well. But so the first activity we did was cooking gluten-free and gluten-containing pasta in the same water. We tested 3 different mechanisms. We first cooked the gluten-containing pasta, then strained it out and used the same water to cook gluten-free pasta. Then we tested for gluten in the pasta. Then the second activity we did was we cooked gluten-containing pasta. Then we strained it out, we washed the pots and put clean water in, boiled it, and then cooked gluten-free pasta. So clean pot, clean water. On the third time, we repeated the first activity where we cooked the gluten-free pasta in the contaminated water, but this time when we strained it, we rinsed the pasta that had been contaminated with a handheld sprayer to see if we could actually rinse the gluten off the gluten-free pasta. The second part of this scenario, we sliced gluten-containing cupcakes with a knife, and then we sliced a gluten-free cupcake with the same knife, and then we tested the washing as well. And then we tested toasters. In this phase of this study, we only tested pop-up toasters and rolling toasters, but in our next phase, which I'll talk a little bit about at the end, we've tested hundreds of different types of toasters, so to make sure that we're not missing anything. In the classroom environment, which I'm not going to go over the results of today, we looked at playing with Play-Doh, home economics baking activities, making paper mache, and then dry and cooked pasta in sensory tables. Go ahead to the next slide. So here are our results from pasta that was cooked in the same water. So on the screen in blue, you have fusilli pasta, and in yellow, you have penne pasta. We wanted to test two different kinds of pasta because we wanted to see if the surface area made a difference and how much gluten stuck to the pasta. And as you can see, there was actually quite a big difference between the fusilli and the penne. However, every single sample we tested crossed that red 20 parts per million line, meaning that there's too much cross contact. This is not a safe practice, so we never ever want to cook gluten-free pasta in water previously used to cook gluten-containing pasta. And so what I just want to also say here is that this is 12 samples that you're looking at on the screen. I don't think that there is anybody in this meeting who would argue with me that this is a bad idea. So with 12 samples, I think we all agree, and if there's anyone who doesn't, please comment, that this is a bad idea. And you'll understand why I'm pointing this out in just a minute. So let's go to the next. Okay, so this was part two, where we had the pasta that was cooked in the contaminated water. We then washed the pots and used clean water and cooked gluten-free pasta. This time, there was no gluten detected in any of the samples, which tells us that washing works, that it is okay to use the same pot to cook gluten-containing and gluten-free pasta, so long as you have thoroughly washed it in between. So this was really great news because a lot of these organizations are recommending that families have to have separate pots and pans for gluten-free cooking and gluten-containing. But as we can see here, if you can wash those pots and pans, you can share them. All right, next slide. All right, so now this was our third activity where we had the gluten-free pasta cooked in the contaminated water from the gluten-containing pasta. And then we drained it into a strainer and we rinsed it with a handheld sprayer. As you can see, none of the samples crossed the 20 parts per million line. However, we did have one that was creeping up there to 17.5 parts per million. So right now we would never recommend rinsing the pasta, but what this data tells us is that perhaps it is possible to remove the gluten once it's been contaminated. So it was good information that will help future study, but right now not a recommendation that we would make. So here's the results from the knife, from the gluten-containing cupcakes to the gluten-free. The blue line represents before washing and the green is after. So as you can see, before washing, the transfer in many cases was right at the line, some crossing the line. So enough evidence to show us that we should not be sharing a knife that has sliced a gluten-containing cupcake and then into a gluten-free cupcake. The same idea goes towards slicing a birthday cake or slicing anything that has something sticky on it like frosting. The good news was that after washing, their gluten was removed to safe levels. Megan, if you can hit next one more time, it'll pop up our different, oh, sorry. There you go. You can do all three. To our three different washing methods. So the first batch was water alone, then we have soap and water and wet wipes. And it didn't really matter what method was used, the gluten was removed. Now, I do want to point out that the washing in this scenario was done by kids, ranging in age from 3 to 16. So even young ones can appropriately wash, even if they're not perhaps doing it as diligently as a grown-up might. All right, so next. All right, so here's our toaster one, and this was perhaps the most shocking to us. So we toasted gluten-containing bread in either a pop-up toaster or for the rolling toaster, we use the one in our hospital's cafeteria, which is heavily used. And every 20 minutes from breakfast through the lunch rush, we toasted gluten-containing bread in the toaster, in the rolling toaster. So it was actually falling into crumbs in the bottom tray. And we could not believe our results. We were just shocked at what we found. So I blew this up a little bit so that you could really see where these lines fell. For the pop-up toasters, we had no samples that had any detectable gluten. They were all less than 5 parts per million. For the rolling toaster, we had 4 samples that had detectable levels, but There were 3 that were in the 5 parts per million range and 1 that was 8 parts per million. So again, these all would have been appropriate to receive a gluten-free label. So now, what do we take away from this? We did detect gluten with the rolling toaster, even though they were safe levels. So we knew we were going to have to continue this experiment on. And the first question that we asked ourselves was, how many samples do we need to test in order for us to feel good about this? So with the pasta, what I asked you guys a few minutes ago is, here are 12 samples that all skyrocketingly passed that 20 parts per million threshold, and we don't need to prove ourselves anymore. We knew there was contamination, and we know we shouldn't do it. But this is a little bit different, because it's hard to believe that you could toast gluten-free bread in a toaster that has visible crumbs in it from gluten and not be detecting it. So here are 40 samples. So almost 3 times what I showed, or more than 3 times what I showed you from the pasta. So how many samples do we need to see? We don't have the perfect answer, but in a few minutes, I'm going to show you what we've done since then, where we've tested hundreds of samples. And again, this is just the data which you'll have, which was published in the paper in a chart form. So we can go ahead. You can go ahead. Okay. So what do we know? There's not a whole lot of data on this. There are a couple other studies that have been done that totally agree with ours. And what we were really shocked with is that we had never seen these studies before. There's one that looked at commercial bakeries, and one that looked, a small study that looked at some kitchen utensils. And what we found was that what we did in our experiment really matched what they had done. We know now that some kitchen activities could pose a higher risk of cross-contact than others, such as cooking pasta in shared water, and that perhaps a set of dedicated gluten-free kitchen equipment and utensils may not be needed for some of these activities. And like I said, we need to keep doing more studies, particularly in restaurants and cafeterias, before globally changing the practices that we've been recommending. So I'm just going to talk about some general, really good practices that we hope that you will follow and advise your patients on. So obviously, we never want to eat food items that have gluten contamination or gluten-containing ingredients for patients with celiac disease. We should always cut gluten-free items first, unless you're able to thoroughly wash in between. As we found, washing does work. So if you can wash, that is acceptable. If you don't have the ability to wash, then cut the gluten-free items first. And obviously, please don't ever use a knife that has visible gluten contamination on it. If you're cooking or preparing foods that both have gluten-containing and gluten-free, always prepare the gluten-free items first, unless, of course, you are able to wash in between, in which case you would be okay. And again, gluten-free pasta should never be cooked in water that has already been used to cook gluten-containing pasta. And as I mentioned, although we did test this rinsing, please don't recommend this practice yet until we better understand and have actual strong recommendations that we can make on how to do that effectively. So I think for us, really the most beneficial takeaway from this so far is that you don't need to have a second set of everything. For so many families that we see, they're dealing not only with being diagnosed with a chronic condition, but food insecurity. Just in the past few months, we've had several families who are homeless, who've been diagnosed through coming through our emergency department, who are eating through food banks, families whose parents have lost their jobs during the COVID time and who can't afford basic food. So to tell them that they must replace their whole kitchen is really not an option for so many of these families. So being able to help them understand how to wash effectively not only helps alleviate anxiety and stress about the diet, but it also helps them to save money. And In regards to the toasters, we believe that you are not doing anything wrong if you are sharing a toaster in your home. Some families might choose to still have a separate toaster, and that is okay. But that we feel very confident that using a toaster oven or a pop-up toaster is probably okay in a home environment. However, in a food service environment, a cafeteria or a restaurant, we are not recommending this right now. We just do not have enough data in these environments to make that recommendation. But in a home, we feel much more confident about that statement. And again, we didn't test any of this in restaurants. So you should always be reminding your patients to double check how food is prepared in those shared restaurant environments. So what are we doing now? So we're currently conducting a multi-center study. There are 6 sites involved in the study to look at this much, much closer with hundreds of samples. So we were right in the middle of the study when COVID happened. And so we still have 3 sites left to do their study days. But I'm going to show you some of the preliminary data that we've gotten. So you go ahead, Megan. So we've so far tested 196 more toaster samples, all of which are less than 5 parts per million or no gluten detected. We toasted in half of them frozen bread and half of them shelf-stable bread because we wanted to see if the condensation from frozen bread made a difference. We also did approximately half pop-up toasters and half toaster ovens, all with the same results, less than 5 parts per million. We've tested hundreds of pots and pans. We've tested stainless and non-stick, and all of them were less than 5 parts per million after washing. We, one of our future sites will be testing cast iron, but we have not received any of those results yet. So I'm hoping we'll be able to give more information on that when we actually publish the next study. We've looked at colanders, testing metal and plastic, and again, all less than 5 parts per million after washing them. And cutting boards, wood, plastic, and glass, and again, all less than 5 parts per million after washing them. So in our first study, we tested them the same way that a food company would test a product when they're sending them to a lab. We verified those by testing them in our in-house lab in Washington, D.C. as well. So they were run only in duplicate and with quarter-gram samples. But we received a lot of feedback after the first paper was published on testing larger quantities. And so for this study and anything going forward, we're actually testing 1 gram samples run in triplicate to be extra confident that we are not missing anything. So we're really taking this seriously and hoping that when we're done with this larger study that we'll be able to make some really significant statements on cross-contact and how to prevent it. So this is one of the studies that I was talking about that was done by a Swiss group, and they found that cross-contamination with gluten may occur with domestic kitchen utensils, but does not seem as relevant as previously thought. Kitchen equipment and utensils used for gluten-containing foods may not pose such a high risk for celiac patients as do wheat flour and breadcrumbs. And cross-contamination during the preparation of food or cooking processes should be avoided by cleaning utensils and washing hands and surfaces regularly. However, overly restrictive recommendations and scaremongering is inappropriate. And this just circles back into everything Megan was talking about. It's so important for us to make recommendations that are appropriate for our patient families, because it really can lead to this unnecessary anxiety, depression, and we just don't want them experiencing that. And this was the second study that I mentioned where they looked at catering in gluten-free bakeries and found that a distance of 2 meters from the use of wheat flour was required to control gluten contamination at less than 20 parts per million, so about 6 feet. And what's been really helpful from this study, we attempted to replicate this in our use of a home economics classroom. And so we're now able to help schools set up their kitchens appropriately so that kids who have celiac disease can participate as opposed to being sent to the library with, an excused pass from the class. Or not being allowed to take those classes. And so we're really hoping that the future of all of this research will lead to really great ways to build an inclusive community so that people with celiac disease are taking the right amount of vigilance to their diet and that they're being included in all aspects of their life. So Megan, do you want me to take questions?
Um, yeah, so we can start with the questions. I do want to just make sure everyone's capturing that we're capturing them in the question and answer box. But I think Vanessa, this is your last slide, right?
Yep.
Okay, cool. So why don't we do some questions and then we'll kind of complete the slides afterwards. So okay, we have first one we have is I have a neighbor with a child with celiac. I'm not their dietitian. His mom saw him take regular cookie, inquired, and said it doesn't seem to bother me. How do you help them understand the importance of compliance, especially for a patient so young? Vanessa, I actually think your take on that would be interesting since you do have a child with celiac disease.
Yeah, so I think that this is one of the reasons that we feel really strongly about kids having the biopsy and really being a part of their medical care. Sometimes families aren't really comfortable having their child hear about their diagnosis. They don't want them to feel like they're different, or they don't want them to feel like they're diseased, and they don't want to talk about it with their child. But we feel really strongly that our patients are really a part of the process and are part of our education sessions, that it's not just for the parents. So I would really recommend trying to find a support group in your area. I know they happen all over the country all the time, and they're even happening on Zoom right now. There are story hours for kids happening where they're reading books about special diets and food. They're doing online art projects that are looking at gluten-free grains. They do trivia games online. And so I think there are a lot of ways to help the kids meet other kids who are managing the same things, where they really talk about what's happening to their body. You can talk to them about their villi and showing them pictures about what happens when they get flattened. But sometimes when the kids are really young, it's hard for them to get it. My son was diagnosed when he was 3, and at the time he had no idea what it meant. He would go to his cousin's house, he would accidentally be handed goldfish and eat them, and then be throwing up for hours. But he didn't know, he couldn't internalize what it meant at that point. It wasn't really until he was close to 5 that he started understanding that eating this is going to hurt me. And now he's very symptomatic. And so for him, he doesn't want to throw up. If a child isn't particularly bothered by it, it's a little bit harder for them to grasp how it's hurting them. But I think that building a community for them and seeing how other kids are managing it, and just having others to feel this with really does help them, and also makes them more compliant just because they're not alone in it. I think that sometimes when a young child is at home by themselves and their sibling is eating gluten, that they can often feel left out. And so they try to find ways that they can be included in it. And so by having a group of friends or others that they can share with will help them adapt better.
Yeah, I agree. I think, making it make sense in terms of something that makes sense to the child, I think that's really the key. Okay, the next question was, my husband has celiac, and something that I have been worried about is if one of his family members touches a serving utensil with gluten on their hands, is there risk for contamination if he uses the utensils and then eats something with his hands? This happens a lot around the holidays when the kitchen's a bit hectic. I think from my perspective, this is really, you never want to with someone with celiac disease with their own hands to put something that clearly has gluten contamination in or near their mouth. So for me, I would say you'd want to wash all the utensils, but I'll also let Vanessa have her input on that.
Yeah, I mean, I think you also have to weigh the risk that if you don't see the gluten there, I'm not sure how much is actually there. Obviously, the safest answer is if you can see that there is gluten or something stuck to the utensil, you should wash it. But again, I wouldn't sit there at the Thanksgiving table, examining everyone's hands and worrying that there's that it's going to get into my food. Obviously, you want to think ahead of time about how to organize the food so that those serving utensils aren't getting contaminated. So, when you set up the buffet, think about putting all the gluten-free things on the table first, and then have people like go across the line so that they're serving all the gluten-free items first and the gluten is at the end, so that they're not going to get to the gluten until they've already passed all the gluten-free things. I always just tell my family, like, wash your hands before we eat. It's good to prevent COVID-19. It's good to prevent the flu or a cold. It's also good to prevent gluten exposure. So, we should just always be reminding people to wash their hands before we eat too.
Mm-hmm. Okay, someone's asking, when I hand wash with our sponge, she's wondering if washing a gluten-containing pot and then washing other dishes would cause contamination. Have you looked at the sponge at all?
So we did use sponges to clean the pots in the study. So those sponges were touching gluten, and then we put clean water in the pots. We did not test the sponges themselves, so I can't say with absolute certainty on the sponge issue. But I try to think about this as how I would treat the kitchen after cooking with raw chicken. If you feel confident that you've gotten, any bacteria from raw chicken out of your sponge, you've probably can confidently get the gluten off the sponge as well.
Yeah.
So, if the sponge is caked in flour, I wouldn't use that to then wash a pot that you're then going to cook gluten-free pasta in. So I think a lot of this comes back to common sense, that if you feel safe, that if you had washed with the rigor to get rid of raw chicken juice, then, I think you can feel good about this.
Yes. Okay, someone is asking about the grill. So for home cooking, do you think that these results could be applied to something like a grill? And has your team looked at that? And the question is, how can families safely grill if they have celiac? Yes.
So we have not tested the grills yet. They're in the same group of samples that are going to be testing with the cast iron skillet. So I don't have any of that data back yet, but I'm hopeful that we'll be able to give more of that in the future.
Okay. Someone's asking about breathing in flour. Is that a risk? In my experience, if you're inhaling something, then probably yes, but I don't know how often that actually happens. I don't know if you have any input there.
Yeah, it's a difficult question to answer because it's definitely dependent on the situation. There are lots of people who report getting sick being in bakeries where there is flying flour. There are people who report, sniffing dog food and that has gluten in it and feeling sick. So I don't have a great answer to the question. Of course, if there's flying flour and it sticks to your lips and you lick your lips, you are, potentially ingesting it as well. But I don't know of any great data on this.
Okay. All right. Do you have any insights on gluten transfer when it comes to using a towel in sanitizer water, as it is commonly used in commercial kitchen environments?
Yeah, so I don't have an answer in terms of data to that question, but it is something that absolutely must be studied. But I do know that when I went to culinary school, there was just so much flour caked to the bottom of those buckets after washing, after baking activities, that I would have to believe that it's a similar outcome to the pasta water.
Yeah.
But again, I don't have any good data to tell you.
Okay. And then the last one I think that we have is, do you have recommendations for communicating to families about these new recommendations or guidelines? It's, of course, we could see patients being hesitant about allowing the same pots and pans or sharing toaster at home. So how is your team communicating that?
Absolutely. And Megan, if you'd like, I can send you the document that we give to families and the document that we give to medical providers to help explain it. So we typically give a copy of the study so that they have the full paper, the two papers that were published, and then what to do with this information, and really how to understand it on the most basic level. And you just have to remember that every family is not going to agree, and that's okay. Some families feel that they need to have separate everything in order to feel confident, and that's all right. But we're really just hoping to be able to tell them what the data says and how they can use that to make their lives a little bit easier.
Mm-hmm. Definitely. someone's asking about the name of the study. I'll be sharing that. I'll probably send you everyone who's on this call the study, so you'll have it. And I think, for the application of the findings, I think what you have here really sums it up nicely. You want to recommend, the recommendations need to limit gluten exposure, but the anxiety and isolation and all the social impacts that being hypervigilant has is really like the point of why you did these studies.
Absolutely. The original recommendations were made with the best of intentions. Everyone wants their patients to do well and to take their guts to heal and for them to be healthy and to feel good. But we also don't want to make recommendations that are making them, be anxious and isolated and not engage with their friends and family and not go out to dinner and not participate in school. So, we think that it's an evaluation of risk and that every situation isn't going to be the same. Every Thanksgiving table is not going to look the same, and not everyone's family is going to handle those utensils in the same way. And so we have to just look at what that real risk is and make good decisions.
Right, I agree. Well, thank you, Vanessa, for your insights on this topic. I know it's a difficult one and something that you're always kind of doing more research into. So I really appreciate you joining us today.
Yeah, thanks for having me.
I did want to just give a shout out to our food service sales rep, Zach Livingston. If you are interested in purchasing gluten-free foods for your school or food service establishment, his contact information is here. But also, Vanessa, your team, correct me if I'm wrong, you guys do education to kitchen spaces as well, right?
We do, free of charge.
Yeah, so if you, I'll include Vanessa's contact information in the follow-up email, but if you feel like you need that at your facility, they can certainly help. They're the experts on this. All right, and with that, we'll wrap it up. Thank you so much for joining, and be on the lookout for an email from me with your certificate and all this other information.